All right, good afternoon, everyone. I am here today with our Health Commissioner, Dr. Zaraza, our Deputy Mayor for Equity, Health, and Human Services, Faith Leach, our Deputy Mayor for Neighborhood and Economic Development, Ted Carter, Dr. Bunley, the head of our Mayor's Office of African American Male Engagement, and our Police Commissioner, Michael Harrison. As we continue to navigate the COVID-19 pandemic, we want to continue to push to get our residents here in Baltimore vaccinated. We are making significant progress. As of today, 71.5% of residents ages 12 and up have received a first or single dose of vaccine, and 62.8% are fully vaccinated. We know that some folks are still hesitant, so we're working through our vaccine ambassadors and other credible messengers to persuade people that getting the vaccine is the right choice, because we know just this year alone we've lost over 400 people in Baltimore City to COVID-19. However, I want to remind everyone that we're still in a pandemic. People continue to lose their lives and or get seriously ill because they are not vaccinated. Cases in Baltimore are rising, and we are still at high transmission level according to the CDC. I want to make sure that we're taking the precautions, whether you're vaccinated or not, as we move into the holiday season, especially for those who have compromised immune system, because we know the holidays have been a time to see significant increases, and we do not want to have a large spike like we had in previous years. We want to limit that travel, of course, and large person events wherever possible. If you plan on traveling, get tested before you return to work. We are at a 2% positivity rate right now, and if we aren't cautious and don't follow best practices, we could see that number jump, and I know no one wants to see that. We have been winning our bout against COVID-19, and we're getting close to the end of the fight. But we can't afford to stop now, which is why we have to get people vaccinated. I want to remind everyone that pediatric vaccine is now available for ages 5 to 11. With school in full swing and the upcoming holidays, we know now is the time to get our young people vaccinated. We know our young people are happier, safer, and learn much better when they are in the classroom. So please, please get your young people vaccinated. Members of the public who have not been vaccinated are encouraged to call 443-984-8650. That's 443-984-8650. Or visit covax.baltimorecity.gov to schedule an appointment. Do your part to protect yourself, your children, your family, and our community. I will continue to do everything I can to make sure that we are keeping people here in Baltimore safe and healthy. And this is why I have authorized an incentive for city employees to get the vaccine to protect our frontline workers and the residents that they serve. The details are currently being hammered out with our labor partners, so everyone should stay tuned for future updates. I will now turn it over to Dr. Zaraza for our current metrics and more information about booster shots and the pediatric vaccine rollout. Dr. D?
Good afternoon, and thank you, Mayor Scott, for your continued leadership. I'd like to begin by reviewing our COVID-19 data. As of this morning, Baltimore City is averaging 97 new cases per day. This is an increase of 58% over the past 2 weeks. Our average positivity is 1.9%, an increase of 32% over the past 14 days. We have seen a 7-day average of 106 hospitalizations, up 12% in the past 2 weeks. In the month of November, 40% of new COVID cases were in children under 18, and 28% were in children under 12. Youth less than 10 and between the ages of 10 to 19 have the highest weekly incidence rates among all age groups right now. Children ages 6 to 10 are experiencing their greatest weekly incidence rates since the start of the pandemic. And among new cases by age group, the highest percentage among all ages is now in children less than 10 for the first time in the pandemic. To date, 63,513 Baltimore City residents have tested positive for COVID-19, and 1,241 residents have lost their lives due to the disease. We continue to show steady progress in our vaccination rate, and now 71.5% of residents aged 12 and up have received a first or a single dose of vaccine. 62.8% of residents age 12 and up are fully vaccinated, and 11.3% of children between 5 to 11 have received their first dose of vaccine. While we are encouraged by the steadily increasing rates of vaccination, just last week, the CDC indicated Baltimore is now experiencing high community transmission, up from substantial community transmission based on this recent increase in cases. What is also particularly concerning is the increase in cases amongst our children. As such, the indoor masking order will remain in place, as masking still remains an effective way to decrease COVID transmission. Also late last week, the FDA and CDC authorized the use of boosters at least 6 months after the second dose for everyone over 18 years old that received Pfizer or Moderna. This means that all vaccines administered in the U.S. are now authorized and approved to provide adult boosters for all individuals over the age of 18. Any person 18 and up who was vaccinated with Johnson & Johnson should also receive a booster dose 2 months after that first or single dose. Of note, boosters can be mix and match, and many of our vaccine providers are also equipped to provide boosters. For additional information, please call our COVAX call center at 443-984-8650, Monday through Friday from 8:30 a.m. to 6:30 p.m., and Saturdays from 9 a.m. to 1 p.m. to confirm that a particular clinic is able to provide booster doses. Your physical or digital proof of previous vaccination will be necessary to receive a booster dose of that vaccine. As booster doses are now available to all adults, the Health Department continues to work closely with our clinical and community partners to provide the primary 2-dose vaccine series to residents who remain unvaccinated. The vast majority of COVID-19 cases and hospitalizations continue to be in unvaccinated individuals. If you have not gotten your vaccine, please take the time to do so now. If you have already received your first dose, thank you, but also remember to schedule your second COVID-19 vaccine. With the Delta variant circulating in the community, individuals need both their first and second dose to get full protection. When you get your first dose, please make sure to schedule and keep your appointment for the second dose. As it relates to pediatric vaccinations, for children between the ages of 5 to 11, in October, we know the FDA authorized the use of the Pfizer vaccine to safely and effectively vaccinate this group. In clinical trials performed in this age group, the vaccine was found to be 90.7% effective at preventing COVID-19. The Health Department and our partners are providing vaccines to this age group through our school-based vaccination clinics throughout the city, as well as through our mobile vaccine clinics focused in low vaccination coverage areas. Pediatric vaccines are also available through our homebound program for children or their caregivers who are mobility limited and need to get vaccinated at home. Additionally, some pharmacies and providers' offices also have vaccine available. Children must be accompanied by a parent or guardian to be vaccinated. Clinic sites offering vaccinations specifically for this population can be found on our website at baltimorecity.gov/BeMoreVax and on our social media. The schedule is updated every Monday. And again, residents can call our COVID call center for additional information at 443-984-8650. Most of the clinics listed on our site are walk-up and no appointment is needed. However, in some instances for our pediatric vaccines, registration is preferred. In addition to our resources, again, if someone has trouble leaving home and wants to get vaccinated at home, they can check out our website at covax.baltimorecity.gov. In addition, many of our pharmacy partners also are providing vaccinations to this group. For that information, go to coronavirus.maryland.gov and click on Find a Vaccine. Lastly, with the holidays just around the corner and cases increasing, we must remain vigilant to protect our loved ones who can't get vaccinated or who aren't yet fully vaccinated. If you're eligible to get vaccinated or are due for your second dose or booster, get it. In addition to us entering holiday season, we are also in respiratory disease season and flu virus is circulating. We recommend that all eligible residents get both their flu and COVID vaccines ahead of holiday plans. The flu and COVID vaccines can be given at the same time. When it comes to holiday gatherings, outdoors is still safer than indoors. And during this holiday season, you may want to continue to avoid crowded, poorly ventilated spaces. If you're sick or have symptoms, don't host or attend a gathering, and get tested if you have symptoms of COVID or have had close contact with someone who has COVID-19 or COVID-19 symptoms. If you're gathering with a group of people from multiple households and potentially different parts of the country, you could also consider additional precautions such as avoiding crowded indoor spaces before travel or getting tested in advance of the gathering to reduce your risk. Again, one of the most effective ways to prevent COVID-19 transmission during the holidays, and certainly the most effective way to reduce the risk of severe outcomes from COVID-19, remains being fully vaccinated. So please take the time now to get fully vaccinated. Thank you.
Thank you, Dr. D. We also would like to use this opportunity today as an opportunity to talk about a 90-day action plan around young Squeegee workers that we announced earlier today. I want to be clear that we are not going to criminalize these young people. And growing up in Park Heights, I understand deeply what many of these youth are going through, that they are often doing this work to put food on the table for them families, for them to eat, to help pay bills so the lights can be on, to help pay bills so that they have water and all the things that adults normally bring to their family. This plan is about making our intersections safer for everyone involved and connecting our young folks with employment opportunities while also providing them the support that they need to deal with whatever is going on in their lives. This will build on the great work that's already being done. Let me say that again, that's already being done by the Mayor's Office of African American Male Engagement and the Mayor's Office of Children and Family Success. I'd like to now hand it over to Deputy Mayor Leach to talk a little bit more about this 90-day plan. Deputy Mayor?
All right. Good afternoon, everyone. So my name is Faith Leach, and I serve in a dual capacity as both Deputy Mayor of Equity, Health, and Human Services, as well as Executive Director of the Mayor's Office of Children and Family Success. I work closely with the Mayor's Office on African American Male Engagement on our Squeegee Youth Strategy. Dating back as early as the 1980s, Baltimore has grappled with a persistent youth panhandling challenge. Over the past decade, Baltimore has seen an increase in Squeegee activity, and COVID-19 has only exacerbated the needs of our youth. That is why we must get at the root causes that drive young people to corners to get their basic needs met. Youth squeegeeing is a visible representation of broken systems, racial inequity, and poverty in our city. These young men and women that squeegee are part of more than 18,000 disconnected young people in our city, most of whom are boys and young men of color. Let me be very clear. This will take all of us working together, city, business, and community leaders to address the challenges facing our young people. Over the next 90 days, the Scott administration will intensify our engagement and outreach efforts. Our outreach staff will be out on corners engaging with young people, connecting them to resources and to employment. We will also launch an effort called Resources to the Corner, where we will work with our partners from city schools to the health department and everyone in between to bring resources out of government buildings and to corners where young people squeegee. Additionally, we will expand our efforts to connect youth that squeegee to employment opportunities. Today, we are announcing the first member of our employer coalition who is here with us today, the Hilton Canopy Hotel. Hilton will employ 10 young people that squeegee for the next 6 months. The city will provide 4 weeks of intensive work readiness training to prepare young people for employment at Hilton. We will expand this model to include partnerships with additional employers. We know that intensive engagement and connection to employment is only the start. To radically transform the lives of boys and young men of color in this city, we have to move beyond surface announcements and programs and get to the root causes that drive our young people to disconnect from school and/or work. That is why, as a part of our 90-day effort, Mayor Scott will launch a Boys and Young Men of Color Cabinet that will engage academic, business, and community partners to build a comprehensive strategy for connecting the city's disconnected boys and young men of color to opportunity. The Cabinet will convene a series of community listening sessions that will inform our strategic framework. The new framework will be presented to the public in early 2022. This work will require that we hold up a mirror to our city. It will require that we take stock of how we contributed to the broken systems that have our children, our young people, stand on corners to panhandle for money, for food, and other basic needs. It will also require that we see our young people for who they are, and some of them are with us today. They are resilient, they are passionate, and they have so much promise. They are all the things that we all love about Baltimore: the hustle, the drive, the determination to succeed at all costs. Those young people are just like you, me, and the Baltimore Ravens. And I want all of them, and I want all of you to know that this mayor, Dr. Bundley, and all of the leaders that are standing behind me today, we all commit to do our very best to connect those young people with opportunity. If you want to learn more about the plan, or if you want to join us in this work, visit aamebaltimore.com to sign up for updates. Thank you.
Thank you, Deputy Mayor. And with that, we'll take some questions. Hey, ma'am, how are you today?
I'm good. How are you?
I'm cool.
In regards to the governor's announcement earlier today about taking immediate actions to fight crime here in Baltimore, do you support an investigation into City State's Attorney Mosby's office and a threat to withhold funding if they do not cooperate?
What I'll tell you is this. I said this before and I'll say it again. To deal with the amount of public safety issues that we have here happening in the city, really happening across the state and around the country, it's going to take an unprecedented level of cooperation. And that's why, for me, my way to pull everyone together is to restart the Criminal Justice Coordinating Council, which both the governor and his folks and the state's attorney and her folks are a part of. That's the way I will have my conversations with the two of them. It will happen in a way that will be constructive, where we're talking about how we can rebuild systems and fix systems and make sure that, because the reality is, as I said before, and when I said to the governor and to the state's attorney, when asking them to come back to the table for CJCC, is that every single part of our justice system and public safety system has some responsibility for things that need to be fixed. Never are you going to hear me point the finger at anyone or one person, and what the governor decides to do is his thing, and what the state's attorney does as a response is hers.
The governor was asked today whether or not he believed you, Commissioner Harrison, and City State's Attorney Marilyn Mosby were capable of getting the job done when it comes to fighting crime here in the city. And he said, obviously, the job is not getting done right now. What is your response to that? Yeah,
I would say that I can see the progress every day. I know that we have a long way to go. I'm not happy, but I want to also say that that includes the governor, as so many public safety agencies that are and responsible for dealing with folks who are coming from prison or being monitored when they have ankle bracelets on work for him. It's about all of us being together. And it's also about not having the media trying to drive this wedge between folks, because that doesn't benefit people. When I have something to say to the governor, I say it like a man to him. As he said to you, he has no problems getting meetings with me and vice versa. We're going to do that, and we're going to handle these things together. But we know what our folks are focused on, and we're going to continue to do that. You guys have heard from us continuously around the amount of people that we're taking off the streets. And just so that you know, we just wrapped up a month-long operation around warrants, where we served 70 high-profile warrants, including first-degree murder, non-fatal shootings, robbery, domestic-related warrants, taking people off the streets who were harming people. We're going to continue to do that. We know that we're focusing on gun arrests. We're going to continue to do that. We're going to bring people to justice and hand them over to the rest of the system. But when you think about us here, we're still, as you know, struggling to figure out how we all, not just me, not just the commissioner, not just the state's attorney, not just the governor, how we all can work collaboratively to deal with the rise in homicides, which I would like to point out for the record is the one category that is up. Non-fatal shootings are down. Robberies are down. Total and violent crime is down. We're going to focus on all of it because I won't be happy until every single category is down by double digits. Next person.
What do you say to people who say that progress is great, but we had a 69-year-old woman killed in a church in the past 10 days, a 5-year-old killed, a 13-year-old killed?
I say that that's a look in a mirror for all of us. And I think that I'm glad you brought up those specific cases because it sheds a little light on what folks have to understand, in particular the folks from your station, right? Because when a 69-year-old is killed in a church, the police are never going to be in that church. To think about, to do that, you have to be someone that clearly is not right in your mind. That means that there were system failures and alarms that went off for many, many years that we did not address with that person, right? For someone to kill a 5-year-old in their own home, right? That means that we missed a boat. Somebody along the way, right? Whether something wasn't reported, we know young people weren't in school, in person, all of those things that were missing. Because when you have a young child killed at home like that, you know it wasn't some stranger that walked into their house that did it, right? That talks about the systematic things that we need to fix because the police are never going to be sitting in someone's living room saying, hey, don't harm that child. That's the reality. When you talk about a young woman that was at a rec center, the place that everyone says we need to continue to open more of, and we went from 40 to 52, right? And she was at a rec center. That means that we have a long way to go when you're talking about dealing with people before they get to that point and holding them accountable. Because if that person who did that didn't have access to a gun that we know is going to be illegal, that we know came from another state, that we know probably has changed hands 4 or 5 times, it wouldn't have happened. And those are the conversations that we also need to start happening. And also, when you talk about folks who want to just sit at home, we all can do something. I'm not going to sleep. I'm going to continue to work. How many people are just posting about these things instead of saying, hey, let me reach out to one of these mentoring organizations to see how I can help one of these young people. Let me organize a anti-violence walk in my neighborhood, something that I did myself for years with no gun, with no fear, because I'm a man and my community is my responsibility before and after I'm mayor. Thank you.
Thank you.
Mayor Scott, the governor, he announced 550 increased patrols throughout Baltimore through state agencies within the last 5 days into Baltimore City. Has that been effective for you guys? Is that enough? What do you need from the governor at this point?
Well, we're glad that they're back. As you know, we asked way back in May to have the state police come back into the city. We know that that was done away with last year because of cuts to the Maryland State Police Department. We're glad to have them back. I'll let the commissioner talk about if we've seen some early success, but we know over the years, which is why it was one of the first things that I asked for in my meeting with the governor originally, that partnership has always been something that's been fruitful for us, even from my time as a council person under another governor when we had that program in. Mr. Commissioner, I don't know if you want to comment if there are any early successes yet or if you guys are still working out the details. So the commissioner and the state police leadership are working out the details and how they're going to be deploying, how they're going to be working in partnership, and they do that in a great way.
Okay, and that's step one. So what else do you need from the governor at this point?
Well, listen, as I just said to your counterpart, we want to see that continued collaboration. We want to see that work with the Criminal Justice Coordinating Council come to bear. And we know that that's not overnight work, right? Because we're talking about systems that the governor himself has been talking about failing for many, many years. Before I was elected, before he was elected, it's about building that work in partnership. We know that we need deeper investment in things like parole and probation. We know that juvenile services needs deeper investment there. Those are also the things that we're going to be talking with the governor about.
Violent Firearms Offenders Act. Are you familiar with that legislation that he's hoping to introduce in the emergency legislation?
I'm pretty sure we'll be discussing it in our meeting. I'm not that familiar with that one. We will be discussing all of the pieces of legislation with the governor in our meeting, but we will see how we go from there.
Thank you.
Commissioner Harrison, can we ask you to respond to the governor's statements? Particularly, he talked about wanting to reestablish patrols in high-crime areas here in the city?
I'll respond to that. The reality is that our police department is always focused in those areas. When you look at our zones and our focus areas, when you look at our gun arrests, when you look at where the police department has deployed, and we're never going to talk about deployment strategies in a public way because we don't want the folks that we're actually trying to prevent from doing these things to know exactly where we're going to be. They're always going to be there. And what the police commissioner will be doing is working with state police and the other folks of the governor's senate to help aid that work.
Thank you.
Emily, you and Jane got a little table over there.
You had mentioned briefly vaccine incentives. Can you tell us anything more about what that program is going to look like, whether it might be modeled over like some of the ones in surrounding areas, and how do you plan to fund that?
I can't as of yet, but Emily, as soon as we work out all the details with our labor partners, we'll be sure to make you at the top of the list of folks to know.
And, at this point, are there any city employees who are being barred from their work sites as a result of not submitting their status and not submitting to testing?
So, Emily, we'll get you the full details on that, but we do know letters have went out about discipline that can happen to folks if they don't follow the mandates, and I'll make sure that we send over direct updates to you.
When did those letters go out?
Ooh, it's a different bunch, so we'll send it all in. We'll make sure that the staff sends it to you in an email because it's a continuous thing.
Okay, I guess I'm just curious how you can reasonably expect people to get vaccinated if you're not going to exact a punishment upon them at some point.
Oh no, they know that it's coming, and when you think that now we're over 70% of folks, which is when we first talked to you guys a few weeks ago, we were at 40. It's a big increase.
Do you have a date for when it's coming?
Can't tell you that. I can't get myself in any trouble with the Labor Commission and our labor partners.
Okay, thank you.
Nice try, though. Jane?
Just to follow up on a COVID question, DC lifted its indoor mask mandate as of Monday. Is there any discussion about that in Baltimore? Understanding that there and here, cases are rising, obviously, but what is the current status of that?
It's the same, Jane. Dr. D and I have, and thank you for the question, have been very clear. We're going to base that off of where we are in the metrics, and we don't want to be in a case, for example, a neighboring place to D.C., Montgomery County, lifted theirs, and guess what happened? They put it right back in the next day. We know that our neighbors in Prince George's also still have theirs. We're going to be looking at it based on that transmission level and the other metrics that you see now on our COVID site.
The other thing I'd like to just get back to the question about the crime issue. Obviously, I've been covering Baltimore and the state of Maryland a long time.
Yes, you have, man.
What impact does it have on your efforts here when you have this, obviously a lot of pressure coming from the governor, but also a lot of criticism coming from the governor of what the city is doing? And at all levels, I might add.
Yeah, I think that for me, Jane, listen, I'm a young boy from Park Heights. Pressure doesn't bother me at all. But what I always want folks to do is come to the table about how not just to apply pressure, but how we can work together. For me, I know how to ignore the noise. I know how to ignore the rhetoric. For me, it's about one thing and one thing only: working to make Baltimore safer. Anything else, I really don't care about. I don't care about how people personally feel about me. I don't care about how people personally feel about other elected officials. I only care about, are they really willing to work with us to make Baltimore safer? And that's what I care about. And that, for me, because criticism, if you're not being criticized, then it means you're not trying. You have to have criticism, but it needs to be constructive. It needs to be based in actually wanting to help, not political rhetoric. And that's why I always say to you, as I say to everyone else, when I have something to say, before I say it to you first, I'm going to be a man and say it to the governor, and we're going to work in whatever way we can together. We're never going to agree on everything to make the city a better place. Thank you. Ma'am?
Hi, Mayor Scott. How are you? I have a couple of questions about the 90-day Squeegee plan. I'm wondering, it's clear that this has been in the works for some time. I'm curious if a few violent incidents in the last few weeks have sped up this announcement today.
No.
Okay, and I'm wondering too, how the young men are responding to this plan. How do you know that they're going to participate and actively want to participate?
Well, I think that if when you actually spend the time in talking to the young men and young women, you'll get to know them a little better, right? Nothing is going to be perfect. I had the opportunity to meet with one of the young men last week and working with him to try to get him into the Department of Public Works, where we need folks to help our solid waste department in a deep way. This is about reaching out and providing opportunities that we haven't done before. Both of my deputy mayors here and my other members of my team were out on President Street taking resources to these young women and men a few weeks ago. Many of them have came into that program, and also just a reminder for you guys, the Mayor's Office of African American Male Engagement is already engaged with over 100 of these young people, working on getting them training. As one of the young men said to me about 2 weeks ago, he says, they're helping me to get myself right first before I can go get a job. This is about working in a totality. As you heard, business, city, everyone coming together to wrap our hands around these young folks to get them in a better place. Because as you heard, squeegeeing is older than me. But what we're not going to do is what has happened in the past, and that's just push everything under the rug. We're going to try to tackle it from top to bottom.
And what happens after this 90 days?
This is only the beginning. We continue to work with these young people. As I said before, we've been doing it before. We've been doing it before these incidents, before you guys were highlighting these things that happened recently. We're going to continue to work intensely through both of these offices and encouraging more of our business community to come on. Let's start hiring these young people. Let's start training them for jobs to make sure that they can help their families.
Have you spoken to any further employers about these employment programs? I know the city does own the Hilton.
Well, we don't own the Hilton Canopy. Let's just start there. So it's a different Hilton. That's not the one. Let's not start with misinformation today.
I appreciate the clarification.
Yeah, we don't own the Hilton Canopy. We have and we will continue to, but we don't want to tip our hat on anybody who's not yet comfortable, but there will be more employment partners.
Thank you, sir.
Thank you all. Thank you. Come on, sir. Sorry about that. Hold on. You're good.
Has a 10-day span in the crime lately, has that encouraged any changes to the recent crime plan unveiled in the summer?
So the reality is again, we have to explain this to you guys. The violence prevention plan is the total violence reduction strategy. The crime plan is the police departments and the police commissioners' plan on how they're going to deal with it. Two different things. And when you think about the incidents that we've had recently, the ones that we've talked to you guys about, a 69-year-old being murdered in a church, a young person being killed at their home, a young person being killed at a rec center, that wouldn't signal to me that we need to not do those things. That means we need to do them more, right? Because we're talking about, and I'm glad he's here today, as Dr. Bunley would say, hurt people hurting people, because that's much deeper than what the police department can do. And for the police department itself cannot be in someone's house and someone's home and preventing them from killing a child. They're not going to be in a church bathroom. That means that we have to build better people. That means that we have to deal with the substance abuse, behavioral health issues that we have in the city. That means that we have to invest in our young people in a much deeper way. And even though this happened at a rec center, that means that we need to open and build even more of them. Thank you.